Hello, it's Frog Dissection Day. Hello. It is Monsieur Frog or Madame Frog. All right, so let's talk about what we're going to do today. First off, this is a grass frog. He is a 3 to 4 inch grass frog. It's pretty attractive. Just check him out before you even think about pinning him down. So here's your dissection tray. We're going to pin the frog down first. You're going to do belly side up. So this is what he's looking like. All right, so I'm going to pin him down. I'm going to show you how we're going to pin him so that you can get to him and not harm yourself. And you might have to use a little bit of force because his hand could get stuck in the position that he died in. All right, so he is pinned down. Do you see how the pins are diagonal? You want to put them this way, going at an angle so they're not sticking straight up because it would be very difficult to cut him. All right, so you have him down right here. You can look and see that he has, his little skin is pretty loose here. Okay, so you can actually take a look at his mouth, and this one has a bug still in his mouth, or a part of a bug. Can you see that? Put him right here. But you can take a look at him. You can pull his tongue out. Now it doesn't stretch out because he is not living anymore. So here's his tongue. He also has some teeth up here. Be careful because it will cut your glove. And also there are some little teeth down here so you can feel his tongue and his teeth. Sometimes you'll find a bug down in his mouth, and he has one, but I'm not going to pull him out. Okay. He also has some external nair. Let me pull this back off real quick. He has his little nose. Sorry, Mr. Frog. So he has his little nose. You can take a look at his external nairs right here. So you're going to go in through the top, and when you go in through the top, it actually comes out the roof of the mouth. So you can use one of your dissecting pins to do that. You can pull his little tongue out. You can feel his teeth that are up here, and there's also a small ridge right there as well. Okay, so let's pin him back down. Remember to pin him at an angle. All right, so first thing you're going to do is take off the layer of skin. I know when we did our virtual dissection, you pinned all this down, but it's really not necessary to do that if we just take off the skin and take off the muscles. So I'm going to use my scalpel. These right here are super sharp. I did replace a couple of them, so be careful with them. All right, so what I'm going to do is just tease the frog. Hopefully you can see this. So I'm just kind of teasing, not cutting down hard, because if you cut and you use too much force, you're going to end up going into his organs. So I'm just going to remove the skin. Okay, when you remove the skin, you can see some blood vessels in there. Remove the skin. Okay, and right underneath the skin, you're going to see some muscle. So here is his little muscle here, and you can see he at one time must have had a 6-pack. Now if you're barely using your scalpel, you can kind of tease it, and that's what it's called. You barely tease it. Okay, I'm gonna pull off the muscular system right here. I'm just gonna barely use, and if you can see this, you can barely touch your scalpel to it, and it's gonna remove the skin. I don't know if this one's a girl or a boy. Remember, you can look at the pads of the fingers, and also you'll be able to see once you get inside whether it's a girl or a boy. Now, if there's some extra juices in here, you can kind of tilt it if you want to. You can use your paper towels and kind of dry it out. All right, so you notice that we can get to this part right here, but there's a thorax that's right here that we have to cut through. So this is like the breastbone of the frog. So you can take your scissors. You probably want to use scissors instead of your scalpel, because you will cut into the heart if you use your scalpel too hard. All right, so once you cut through that bone that exists right here, you can cut the bone away, or you can leave it like it is, or you can actually pin it down if you want to. So it's going to take a little bit of force though to pin this down. And thank you to Jada and Destiny for setting us up today so that we would have everything ready. Appreciate it. All right, so when you're looking at the frog, you will see some parts that you will know. So we see the heart right here. Okay, so there's a heart. There's also 3 lobes to the liver. You can lift these up and you will have a pad, a little, actually a little dissecting, oops, sorry. You'll have one of these right here. So I'm going to have it like a little chart on your table. Yes? Okay. So a little chart on your table and you'll be able to tell what each organ is. So I'm going to put these out for you guys. All right, so when I'm looking at it, you can see some fat bodies, you can see the stomach, you can see the large and small intestines. Okay, so what we're going to do is we'll kind of walk around. You have to be very careful when you're taking out these organs, because if you puncture them, then you're not going to be able to tell, you know, what they are. So you got to keep everything intact. So I'm seeing some fat bodies. That's what keeps the little frog warm. I can also see back here the lungs. I can see all kinds of organs in here. So what you're going to do, guys, you can also take off the skin. You can go down to the muscular system, find the femur of the frog. You can take his little eyeballs out if you want to. I know that's pretty graphic. But if you use this right here, it has a diagram right here of the abdominal area. Also the female and the male. You've got the heart. The brain is very, very difficult to find, so you might want to wait till the very end of the dissection to figure out if you can see the brain. You can see the skeletal system and the muscular system. So I'm not going to go into cutting all of this because I want you guys to be able to do it yourself and see what's going on. Just be very careful when you're removing these organs. And I can see right here, it must have been a little too rough because, well, that's right there is the liver. So you have to be real careful when you're cutting into them. All right? Now, don't forget, guys, that you're cleaning up your area. Make sure you're rinsing your tools. Keep your gloves on until everything has been cleaned. So this is just a quick little idea of what you're going to be doing today.